I want us to look at Tinea Capitis. Tinea, we remember, just to refresh our mind, that this is a mycological agents or conditions that we normally get infection from fungal agents which affect the superficial layer of human beings. When you talk of superficial layer, we are simply meaning the skin, and then different parts of the skin, the head, the nails, the groin, the waist, and all that. But now, for this case, when you talk of Tinea Capitis, this is a fungal infection that is majorly affects the scalp. Fungal infection that affects the scalp. And we just to refresh your mind that we talked of when you talk of dermatophytes are those fungal agents that affect the skin. And for this case, Tinea Capitis affects the scalp. The scalp is the head. It is common in children, especially those children you see them with mashilingi and all that. That is purely what we are talking about, Tinea Capitis, or what we call tiniasis. It's frequent in children, yes, common, but also you can find men, or rather adults, also having this. Some of the fungal agents, some of the fungi that affect the hair of the scalp is what we call Trichophyton and Microsporum fungi. These are common fungal agents or fungal microorganisms that affect the hair. Trichophyton and Microsporum. These are more of really should be genus because we have more of sub species within this group. Some studies, like for example in New Zealand, shows that Microsporum canis is the most common dermatophyte fungi to cause Tinea Capitis. So Tinea Capitis is a condition, is the fungal disease of the skin, of the hair rather, the scalp, the hair. But being the condition, the disease, what kind of fungi causes tiniasis? We have said the two common genus or genera, we have the Trichophyton and Microsporum. And in New Zealand, we talk of M. canis, that is Microsporum canis. It was the commonest dermatophyte fungi causing Tinea Capitis. Studies have also shown that this fungi is more zoophilic. It grows naturally on an animal rather than human. So human get infection as across because of our contact with animals. So I've shown that like this M. canis, it's caused by what you call kitten, or rarely an older cat or dog, but mostly these kittens of the cat are the ones which, because we love them, they're like pets. When you keep on interacting with them when they're having infected hair that is infected, again we can contract it. Other types of species within this, we have Trichophyton verrucosum, which originate from cattle. We have Trichophyton metacrophytes, Xerophyte equinium, which originate from horses. We have Microsporum nanum, originating from the pigs. We have Microsporum distortum, which is a variant of M. canis found in cats. And like in the United States, the most common fungi that causes Tinea Capitis is what we call Trichophyton tonsorans. It was found to be a common cause of Tinea Capitis. which is spread from one person to another naturally. Therefore, that's what we call anthropophilic infection. We have so many species. We have Trichophyton violacum, found especially in African patients. We have Microsporum audoni, also in African patients. Many of them are here up to what we call Trichophyton sudanense and Trichophyton yondae. So when you talk of dermatophyte fungi, most of them studies show that some of them can originate from the soil. We can just get a contamination of the soil, and therefore we call it geophilic organisms. Geophilic infection can get from the soil. When we come into contact with the soil, use barefoot, digging, or even contaminated soil within the environment and all that, though it's rare. So when you talk of types of Tinea Capitis infections, remember we are talking about Tinea Capitis infection of the scalp or the hair. So normally this Tinea Capitis is classified according to the fungi that invades the hair shaft. For example, when you talk of ectotrix infection, this is dermatophyte infection that remains confined to the hair surface. It is confined to the hair surface. That's where we call it an ectotrix infection. This is where the hair is inverted due to the infection with the. So some common species that causes ectotrix infection is M. canis, that's Microsporum canis, Microsporum audoni, Microsporum distortum, Microsporum pharyngianum. We have M. gypsum, M. nanum, then Trichophyton verrucosum. So this type of fungi are the ones that easily causes what we call ectotrix infection, an infection that just is confined to the hair surface of the body. When the growth is there, the fungal branches or the hyphae and the spores for Arthrochonidia, that the way we covered, covers the outside of the hair, and this kind of infection can be identified using what we call Wood's light. It can be, the light can be passed to carefully check the infected area, and people can be able to know if the infection is just localized with their what we call the hair shafts. Then number 2, we have what we call endotrix infection. This is where the dermatophyte infection of the hair that invade the hair shaft and they internalize into the hair cell. Okay, just from the terminology or the wordings, ecto, it is localized on the surface, but which surface of the hair shaft? But endotrix, after the infection of the hair shaft, this kind of fungi are able to be internalized, go into the what we call hair shaft. So for this endotrix inversion results from the infection with types of fungi that can cause this kind of endotrix infection. We have Trichophyton tonsorans, Trichophyton violacum, and Trichophyton sudanense. So when you are keen, you realize that most of the species in the Microsporum causes ectotrix, infection of the hair shaft that remains on the surface, M. canis, M. gypsum, and etc. But most of the species in the Trichophyton genus are commonly cause what you call endothrix, infection that goes deep into the hair cells. Examples are there, T. tonsorian, T. foliaceum, etc. Number three type of Tinea Capitis infection, we have the favus or favus. This favus is caused by Trichophyton scoleni. So this colony infection results in what we call the honeycomb destruction of the hair shaft. It affects and destroys the hair shaft. What will they guess? Of course, the hair will fall off and you start having artificial baldness because of this infection. So those are the three types of teniasis that can be there based on the type of microorganism that causes it. What are the clinical presentation of when somebody is having Tinea Capitis? As I said, it is common or prevalent between 3 to 7 years old children, but also it's more common in boys than girls because boys that are outgoing, playing together, playing paper ball or ball, jumping here and there outside, they're socializing. But most importantly, boys also do not like to take shower so much. So because of that sweat and sleeping with the sweat, dampness, that again accelerates the infection. So common uh, infections from T. tonsorians, which also this one is can also occur in adults. For anthrophilic infections such as T. tonsorians are more common in crowded living conditions, as I've said, or what we call through sharing of contaminated hair brushes, clothing, towels, bags of seeds, where you there traveling around and touching, sitting with the same chairs or seats, you can also contract. Um, Presentation or clinical features, one of them is what we call dry scaling, like dandruff, but usually with moth-eaten hair loss. Okay, the way I told you, because it affects up to the what we call this, the hair shafts. Most of the hair is lost, and some would remain with what we call baldness. Apart from that, that dry scaling, you can also have what we call black dots. The hair are broken off, you know, and when the hair is broken off, the scalp surface remains scaly. We also have smooth areas of hair loss. Then from there, we also have presentation with what we call Kerion. These are very inflamed mass, like an abscess along within our scalp, especially in the head, where we can have that kind of infection or presentation, abscesses, inflamed masses. Then you can also have favus. Favus is yellow crusts and matted hair, which the hair is broken. You could see if its hair is already kind of broken hair, creating some sort of baldness in batches along around the hair. So people who are carriers do not have symptoms, and they only have what we call mild scaling from these T. tonsorians. This tinea capitis may result into swollen lymph nodes or glands at the side of the back of the neck. If it's untreated, Kerion, hair, and fevers may result in what we call permanent scarring. That's bald areas. So it needs to be treated. Uh, just a minute. So we've now generally looked at, you know, Tinea Capitis as a skin condition caused by fungi. There are different species. Now, when you look at specifically what we call M. canis, we want to see what does the M. canis able to do. That's how it appears in some of the infections. When you talk of Kerion, that is how Kerion kind of, you can see the whitish scaling that is there, and the hair is gradually being lost. The baldness is being created. How do you diagnose this Tinea Capitis? You can use what you call wood slide fluorescence used, but not diagnostic, as it's only positive if the responsible organism fluoresces. If the organism doesn't fluoresce, then you cannot be able to do it. But it can be confirmed through microscopy and culture of the skin scrapings and the hair pulled out by the roots to go and check if there is that fungal infection. Sometimes, apart from the scrapings or culture of the skin scrapings, we can also do what we call skin biopsy if it is some sort of masses, swollen, inflamed. You can do that so that you check for the characteristic histopathological features of the Tinea Capitis. How do we treat this Tinea Capitis? Mostly it's treated using oral antifungal medicines, including Griseofulvin, taba, Terbinafine, and Itraconazole. This can be used orally to treat. But if the origin is from anthrophilic infection, then all members of the family should also be treated to avoid the spread, or rather it can be examined, checked. If there is that kind of tendency, then you treat all of them. You can also do brushings of the scale areas of the scalp should be taken for mycology. Then the whole family can be tested for that matter. Okay. If it's for a group like people are together, parents of classmates or other playmates to be informed of their children. You know, we can have what we call mass treatment if it's in a school or in the family, so that it prevents or avoid this kind of spread of this Tinea Capitis. We can also encourage people to use antifungal shampoo twice weekly for 4 weeks. And I know this is very good with the ladies. We men, we want to keep our hair short, but in most cases, not very clean. Of course, women also have very dirty hairs because after they have plaited, they may not want even rain to accidentally, you know, rain on them because, they want to keep the beauty. But the hygiene, that's where the problem is. And this kind of fungal infection likes dampness, places where there's no proper cleanliness.